Back to School Week continues on KHQA this morning. Lindsey Boetsch is with us now.
And we're learning about eye exams this morning.
Morning. Yeah, I had my first eye exam when I was in 3rd grade. I remember actually sitting at the kitchen table and looking at the clock, and I told my mom, I can't read the clock. So that was when we went. I've had glasses ever since then, so it's been a very long time since I've had them, I suppose, for my very short life so far. But a lot of people have glasses. Chad, you've had LASIK. Tegan, I know, has had glasses for forever. Melissa has glasses as well. So it's a very common thing, and there's ways to figure out how you, or if your kids need glasses. And the kids should not be afraid of these tests. Ryan Hewlett joins me and explain a little bit about what people come, after you fill out the paperwork, this is the first stop you come to.
Yeah, this is the pre-test room. They come in, if we're talking about kids, come in for an auto refraction, also to do a stereo and a colorblind test, especially color blindness. We check that in mainly males, but it does come, can come in females as well. So the first stop is the auto refraction machine. Basically, we sit the children down and have them look through the machine and kind of get 3 different steps for a certain reading for the doctor, as well as a possible prescription comparison.
So it's kind of a starting point before you go into the other room.
That's correct. Yeah, they come back here with us, get them a little more comfortable with their environment. Being kids, sometimes it can be a little stressful not knowing what they're going into. So we kind of make them comfortable before they have to go sit in the big chair with the doctor.
And what is this machine?
This is an NCT glaucoma pressure test machine. We don't do that on the children unless it's recommended by the doctor to a certain age.
So if you're coming with your kid and you say, I'm going to get mine done first, you need to make them aware that they're not going to get this done too.
Yes, unless it's recommended by the doctor for certain issues. If the doctor needs to, they can dilate the patient in order to do a further test for glaucoma. So.
And this test is the little puff when you get the puff of air in your eye that everybody, at least I wince at that.
You should try that.
No, maybe a little bit later. And what is this one?
This is a visual field examination, checks for peripheral blind spots.
Okay.
Usually for ages over 35, or if you're having predominant headaches, issues when you're driving, things like that.
What should parents look for to see if their kids need to come to the eye doctor?
Looking for running into tables, little things like that in their little kids. We've seen kids in as early as 18 months with issues with vision. A lot of times that's actually caught pre-exam. They go see their regular pediatrician and there's some issues going on that they want them to see an optometrist or even ophthalmologist.
All right, and we're going to move into the doctor's room for the next segment, so we'll catch you a little bit later on in the show.
I'm at that age where I never pay more than $1 for my glasses.
Nice. Well, I was going to say,
the reading kind, because
she pointed out she has glasses, Tegan has glasses, I had LASIK, Melissa has glasses, Miss Eagle Eye here.
I am the only one of my family of 9 kids.
Never had glasses.
Never had glasses.
Never had a problem.
Never had a problem.
Wow.
I'm like this perfect specimen or something.
Do you go to the eye doctor? A perfect specimen. Lindsey Boetsch is with us now. She's deciding which is better option for her, 1 or 2. 1,
3,
or 2,
or 4.
I don't know.
She got my joke.
Sometimes it's not as easy as 1 or 2. Sometimes they look fairly similar, and in most cases I end up saying they're about the same. But what does that mean? Well, this is the machine that they use to determine that, and Ryan Hewlett's with me. What does this do?
This checks for the prescription when they're reading the letters, just to make sure which line is the clearest. The doctor will check, for visual clarity in reference to, which line is the best. So that definitely helps, get the prescription accuracy just right for the doctor and make sure that we prescribe the right prescription for the patient.
And this is for adults, this is for kids, so when the kids come in after the first room, they'll come in here and sit down, and then what? Exactly.
The doctor will sit the patients down, especially kids, and explain exactly what they're going to do. That way they don't get any scared or anything like that with the patient. The next machine here, this actually is to help the doctor see the health of the eye. It's a very bright light, so that can scare the kids a little bit, but the doctor kind of makes it comfortable for the patient.
And the way that this works is kind of cool. This is the machine that shoots the letters to one mirror, and then it goes back to this thing, which then goes back to that mirror somehow. Very cool way to do it, and there's a lot of things that maybe kids are scared about, but it's really not a big deal. Like I said, I had my first eye exam when I was in 3rd grade. What is probably the scariest thing, I guess, when the kids come?
I think it's the idea of getting over the fact you're at the doctor's office, and most kids' experiences the doctor's office isn't always the greatest. So when they come here, we really try to make the atmosphere more comfortable for them with the doctor. Our doctor is very good at, chair manner with the children. So you know, they come in, they get comfortable with the doctor, they get comfortable with the staff, and they feel more comfortable being around our store. So it really helps with the doctor so that she can get the kids to be, you know, somewhat forthcoming with what's going to work for them.
All right, and if you find that your kids do need glasses, we're going to find out the ways to pick the best frames for them coming up in the next segment.
Lindsey Boetsch is with us now.
She's learning all about eyes, and she's teaching us a thing or two.
Yeah, and there's so many frames that you can find that you can, I mean, if you walk into any eye store, you see tons of frames, but how do you know which ones are the right ones for your or your kids? I mean, you can go by what you like, but also by your face shape, and obviously these kids' frames are not going to fit on my face, but what's the first step in looking for a pair of frames for a kid?
Well, the first thing we do with the kids is obviously find something that they like. And then we let the kids pick out what they like and kind of talk with the parents and see what the parents are looking for their children. Now, most parents want their kids to wear a certain style or let the kids pick out their frames. The nice thing about us is we have a buy one, get one free. So the kids get 2 pair of frames and prescription lenses for the price of 1. So the kids may get a good pair that they like, and then the parents get them a more reasonable pair that they decide is best for their children. Then the thing we look for fit with kids is width of the face, also the size of the lens in reference to what they need for their prescription. Fit around the ears. A lot of kids have a hard time with them sliding off, or they're very active. So when kids are very active, we have to find frames that can stay on their face a lot easier. These frames right here, for instance, they may not look the greatest, but they fit kids very well with the back temples there that wrap around the ears. They stay on a lot easier. We can adjust them a lot better. Other frames that'll do that, like your plastic style frames, which are more popular these days with the little kids, they've got more design to the frame. They bend a lot easier. They've made with a certain material inside the plastic that we can heat up that bends very well to stay on their face structure. So it works both ways. I mean, it really just depends on the kids, the facial structure of the kids, and the fit. But we can definitely find something that's best for them.
So even if they necessarily don't fit the back of the ear, you can still fit them to fit the kid.
Yeah, correct. Yeah, there's multiple different styles of frames that would do that. Some are a little more difficult than others. We have to use a little bit more heat on the metal. But like I said, the plastic frames and of course these frames with these hook earpieces do the best job. Is
there a certain age when kids should switch over from the kids' lenses to the adult lenses, or does that depend mostly on the shape of the head?
I believe every optical department is different. These are strictly for like kids anywhere from 18 months to probably 8 to 9 years old, depending on how the size of the kids. Now, all of the rest of our selection in the store, we can find to fit juniors. They go into our unisex or kids, women's, men's department. So it really is really just dependent on the age and the growth of the child.
All right, sounds good. And out of the 5 of us that are on the morning show this morning, I believe Sarah is the only one who has never worn glasses before or been prescribed glasses. I know you mentioned getting the dollar ones from the packages or whatever, but what?
Not good, Sarah.
Oh, Ryan's saying not good, Sarah.
Well, I think I know why she's never had glasses, because in the joke in the earlier segment with the flipping of the lens, do you like 1 or 2 better? She's like, what does that mean? I had to explain to her. So I'm like, you've never been to the eye doctor.
Maybe not. Oh, but I don't need to. I can see.
Maybe you've just eaten a lot of carrots as a kid, and then you just keep eating carrots, because I heard those are good for your eyes.
So I'm not supposed to get the magnifying reading glasses that cost $1. I'm going to have to talk to Ryan about that and see.
Do what works best for you, I guess.